A major portion of a red blood cell consists of hemoglobin. Hemoglobin is a complex compound that transports oxygen in the body. The medical assistant may perform a hemoglobin determination in the medical office. The purpose of this test is to determine the level of hemoglobin in the blood. The amount of hemoglobin in the blood ranges from 12 to 16 grams per deciliter for a female and 14 to 18 grams per deciliter for a male. A low hemoglobin level may indicate anemia, blood loss, or fluid retention. An elevated hemoglobin level may be due to dehydration or a condition known as polycythemia. The medical assistant will show you how to perform a hemoglobin determination using the StatSite hemoglobin meter. Before proceeding, sanitize your hands. Assemble your equipment. For this procedure, you will need the hemoglobin meter, a container of test cards, a lancet, a capillary transfer tube, an antiseptic wipe, sterile gauze, and an adhesive bandage. Check the expiration date on the container of test cards. Before running a test on a patient, 2 quality control procedures must be performed. They include calibrating the meter and running controls. The medical assistant will first show you how to calibrate or code the hemoglobin meter. This must be done each time you begin using test cards from a new container. Calibrating the meter compensates for variables that occur in the manufacturing process of the test cards. The meter is calibrated using a code key that accompanies the container of test strips. Remove the platform from the meter by pushing up on the tab of the platform. Insert the code key into the opening marked with an arrow. Turn on the meter. A 3-digit code number appears on the display screen. The number must match the code number on the container of test cards. As you can see, the 3-digit number on the display screen is 924, which matches the code number on the container of strips. You may leave the code key in place and replace the platform. The medical assistant will now show you how to run the controls on the hemoglobin meter. 2 levels of controls must be run each day before you use the meter for the first time. Running controls ensures the patient test results are reliable and valid. You must run a low-level control and a high-level control on the hemoglobin meter. The control solution for this hemoglobin meter must be stored in the refrigerator. Make sure it is at room temperature before you use it. Next, check the expiration date of the control solutions. Turn on the meter. Check to make sure the code number matches the number displayed on the container of test cards. Remove a test card from the container and recap it immediately. When you see a flashing test card symbol, insert the test card into the meter. Slide the edges of the test card under the guide tabs on the test card holder. It is important that you insert the card fully to the back. You will feel and hear the test card lock into place. When the meter displays a flashing drop symbol, the meter is ready to accept the control solution. Apply gloves. Roll the low-level control solution between the palms of your hands to mix it. Do not shake the container. Apply 1 drop of the control solution into the well located in the center of the test card. Promptly replace the cap of the control solution. After a short countdown period, the control result is displayed on the screen of the hemoglobin meter. If the control result is within acceptable range, it will fall within the expected control range listed on a reference sheet accompanying the control solution. As you can see, the result of the low-level control is 10.2. The control result falls within the low-level expected range listed on the reference sheet, which is 9 to 12.8. Next, you must run a high-level control following the procedure just demonstrated. As you can see, the result of the high-level control is 16.0. The control result falls within the high-level expected range listed on the reference sheet, which is 13.2 to 17.4. Remove your gloves and sanitize your hands. Record the control results in the quality control log. As you can see, at the top of the log sheet, you must record the name of the meter, the lot number and expiration date of the test cards, and the code number of the container of the test cards. You must also record the lot number, expiration date, and expected range for each control solution. On the bottom of the log sheet, you must record the date, the low-level and high-level control results, whether or not the results were within acceptable range, and your signature. The medical assistant will now demonstrate the procedure for performing a hemoglobin determination on a patient. Begin by sanitizing your hands. Greet the patient and introduce yourself. Identify the patient by full name and date of birth and explain the procedure. Turn on the hemoglobin meter. Check to make sure the code number matches the number displayed on the container of test cards. Remove a test card from the container and recap it immediately. When you see a flashing test card symbol, insert the test card into the meter. Slide the edges of the test card under the guide tabs on the test card holder. It is important that you insert the card fully to the back. You will feel and hear the test card lock into place. When the display shows a flashing drop symbol, the meter is ready to accept a blood specimen. Open the gauze pack. Cleanse the puncture site with an antiseptic wipe. Allow the site to air dry to give the alcohol enough time to destroy the microorganisms on the skin. After cleansing, do not touch the area. Wipe the area with gauze or fan the area with your hand. All of these actions can cause contamination, and the cleansing process has to be repeated. Apply gloves. Perform a finger puncture and dispose of the lancet in a biohazard sharps container. Wipe away the first drop of blood with the gauze pad. Gently massage the finger until a large drop of blood forms. Collect the specimen using a capillary transfer tube. Do not squeeze the bulb of the transfer tube while you are filling it. Fill the tube to the black fill line. Place a gauze pad over the puncture site and ask the patient to apply pressure. Hold the transfer tube over the center of the test card. Squeeze the bulb of the transfer tube and expel the entire specimen into the well on the test card. After applying the sample to the test card, a countdown period occurs while the meter analyzes the blood specimen. When the countdown is finished, the result appears on the display screen. The test provides a direct reading of the amount of hemoglobin in whole blood in grams per deciliter. As you can see, the hemoglobin test result for this patient is 11.6 grams per deciliter. The result falls just below the normal range for a female, which is 12 to 16 grams per deciliter. Remove the test card by lifting it slightly as you slide it out of the meter. Dispose of the test card in a biohazard waste container. Check the puncture site and apply an adhesive bandage to the patient's finger if needed. Remove your gloves and sanitize your hands. Chart the results. Include the date and time, the name of the test, and the hemoglobin result. If you are employed at a medical office that uses an electronic medical record, chart the results by entering the appropriate data into the computer.